necessary for all of them to go out?
Okay, so in terms of the patients we see, let me just try and clarify. So patients are referred from most of the southern region to be able to come here because this is the only center in the southern region where they can have echocardiography done. So when they come here, some do have cardiac conditions, some don't. So for those who don't have cardiac conditions, those we discharge. Those with cardiac conditions, there are some which I could classify as mild cardiac conditions, where we can manage, where we just follow them up, and some we need to give them some treatment, but some will actually need surgery. So in terms of surgery, we're not able to offer it locally. So for the patients that we diagnose and need to have surgery, they will have to look for help outside the country. So most patients end up going to India and to South Africa.
So do you offer them medication?
Yes, we offer the medication, but in most of the conditions which will need surgery, medication is to just support the child to be more comfortable while they are waiting for the definitive procedure. It will help them to be, so for example, if they come and they're having difficulty breathing, if we give them some medicine called anti-failure medication, it will help them to be more comfortable. But what they actually need is for whatever defect is in their heart to be corrected, because the medicine is just supportive, but it's not going to cure the child. And as time progresses, some of them will become inoperable because of the damage that would have been caused by the defect. And then if they get to an inoperable stage, unfortunately, would have missed the boat, and an operation wouldn't be helpful. So ideally, we want the children to be diagnosed early, so that when they're diagnosed early, we're able to at least tell the family early enough so that they can try and see how they can help their child to get surgery.
Okay, so do you make follow-ups for those referred outside the country to establish whether they've been able to raise funds?
We do try and make follow-up. Unfortunately, at the moment, I'll say it's quite depressing because since I came, I think there have only been 2 patients that I'm following up currently. We actually managed to go and have surgery and to come back to the country. Some of them, they're still trying to get assistance in order to get surgery. But like I was saying, unfortunately for many of those patients, if they don't manage to get that surgery on time, it may be late, which brings me to my main aim, which is to at least have those services here, so that at least we can make them available in good time to our patients.